Hello, this is Nelton Tobias, a medical student at KSMUCO, and today I'll be talking about major depressive disorder or simply depression. On the introduction, major depressive disorder is a mood disorder marked by episodes of depressed mood associated with loss of interest in daily activities. So, the key points here are two: depressed mood and loss of interest. And these patients may not acknowledge their depressed mood, but may express about somatic complaints such as fatigue, headache, muscle tension, and abdominal pain. On the etiology, the exact cause is not known, but it is associated with multi factors such as genetic, biological factors, and psychosocial factors. So, in genetic, it is related to first degree relatives. So, uh, if a patient eh, with depression and you talk with the patient through history taking, and you might find out that maybe their parents had depression, or their cousins. So the other factor is the biological factor. So in biological factors you might find diseases like cancers, eh, those kind of diseases might predispose a person to depression. Also, psychosocial factors such as interpersonal conflicts, conflict between the family, conflict between a friend, or loss of a loved one, they can predispose a person to depression. But also, not forgetting, major depressive disorder has been linked to decreased levels of monoamines such as serotonin, norepinephrine, and dopamine in synaptic cleft of central nervous system. So these monoamines they are responsible for regulation of mood, sleep, and behavior. On the symptoms, it has been summarized by a mnemonic called SIG E-CAPS. So this will help you to memorize the symptoms. S is for sleep, in which patient may have decreased night sleep or increased daytime sleep. I is for interest, in which mostly the patient have reduced the interest. And G is for guilt. E is for energy. Mostly the patient have reduced the energy. Also, concentration is reduced. Appetite may be reduced or increased. The patient may not eat at all, or they may eat a lot. Also, psychomotor activities may be altered. For example, the patient may have psychomotor agitation, such as restlessness, or the patient may have psychomotor retardation, which is being very, very calm, extremely calm. And the last one is suicidal ideation. This is a very important symptom, and it needs hospitalization or very, very careful watching because the patient may harm themselves. The diagnosis of depression, we use DSM-5 criteria, and DSM-5 stands for Diagnostic and Statistical Manual for Mental Illness Classification, and this is version 5. So two criteria must be met to diagnose depression: A and B. A is the patient must have at least one major depressive episode, which lasts for 2 weeks, and the patient should have no history of manic or hypomanic. On the treatment, they are categorized in two parts: non-pharmacological and pharmacological. On non-pharmacological, there is interpersonal therapy, in which it is focused on the interpersonal conflicts. And the other one is cognitive behavioral therapy. Here, the therapist focuses on the cognitive distortions of the patient. So, the therapist may help the individual to learn new coping skills or mechanisms. In pharmacological, we use medication such as antidepressants. There's SSRIs, there's MAO-Is, TCAs. The SSRIs are selective serotonin reuptake inhibitors such as sertraline and fluoxetine. They are used in treatment of depression, and their only mechanism of action is by increasing the level of monoamines in the synaptic cleft. So they inhibit the enzyme, eh, or the transporter which bring back uh, the the monoamines back into the presynaptic membrane, into the vesicles. So they lead to prolongation of activity of monoamines at the synaptic cleft. Also, that is the same mechanism of action for MAOs and TCAs. But in the part of ECT, this is electroconvulsive therapy, in which the doctors use they induce seizures. This is not a medication, so it is like it is a procedure, and it's only used when the medication are not helping at all. And these are my references, such as First Aid Psychiatry and Mastering Psychiatry. These two books, they are all good for learning psychiatry. So, as you have seen, I've just gave you an overview of depression. So, in order to be competent, you need to go into these books. And thanks for watching this video. Subscribe to my YouTube channel for more videos. Thank you and have a good day.